Hi again, I'm back, and we're going to continue this PowerPoint to the end and begin this lecture with Chapter 10, Infection. Okay, so first slide here, talk about the 4 stages of infection. So when we talk about the clinical process of infection, it occurs in 4 distinct stages. So the very first one, stage 1, incubation period, the organism's growing and multiplying. This incubation period time frame is from when the patient is exposed to the onset of the first symptom. So there's many diseases, infections that somebody's contagious and they don't even know yet because they're in the incubation period. So from exposure to the onset of first symptoms. This could last maybe just hours, it could be days, it actually could be years as well. The second stage of infection is called the prodromal stage. Person is most infectious. They have vague and non-specific signs of disease. So this is the occurrence of initial symptoms. Initial symptoms kind of like mild fatigue, mild discomfort, just general malaise, something's up. I feel like I'm getting sick. And they are the most infectious here. The third stage is the full stage of illness. Another name for it is like the invasion period. So it's the actual invasion of the illness, and the symptoms are full stage. Presence of specific signs and symptoms of that particular disease. So during this stage, the pathogen's in the body and it's multiplying rapidly. Inflammatory response has triggered. Now remember, inflammatory response is a normal response, but there certainly are signs and symptoms that go along with it. So they have specific signs and symptoms of whatever that disease is. The fourth and final stage is the convalescent period, recovery from the infection. So convalescence basically means recovery. So what's happened here is this person's immune system has successfully removed the infectious agents, and the symptoms start to decline or go away. This is just some basic microbiology, just to kind of review. There are different types of bacteria. You know that there's the spherical cocci, which is the circles, the spheres, Streptococcus pneumonia. These are the coccus, Streptococcus pyogenes, Micrococcus, Staphylococcus, spheres. The second one is rod-shaped bacilli. So bacillus, which are the rod shapes, the bacteria is the rod shape. Some different causes. You don't need to memorize these different diseases, just some examples for you. And another one is a spirochete or spiro-shaped, and then there's other ones as well. So they kind of have this tail, they kind of do this swimming. Cholera, H. pylori, which is a very prevalent cause of stomach ulcers, Treponema pallidum, which is cause of syphilis. So these are back in infections that are spirochetes or spiro-shaped. Do not need to memorize this. This is just kind of interesting. Just common bacterial infections, the bacterias, and when they enter the body, where they invade. For example, strep pneumoniae obviously invades in other places, but it invades and goes into the brain and causes meningitis. Strep pneumonia goes into the ears and causes otitis media. It goes into the lungs and causes a community-acquired pneumonia. You can see here Streptococcus. So these are specific bacteria that cause central nervous system issues. Mouth, some strep, respiratory tract, staph, MRSA, Pseudomonas, and Streptococcus. Those are 3 big ones. H. influenzae, Moraxella, and then there's a bunch of gram-negative bacteria that can invade as well. Skin and soft tissue, 1 and 2 are staph and strep. Just lives on the skin, and when there's wounds, it infects it. Urinary tract, the primary one is E. coli. Tons of E. coli in our gut, but when it transfers into the urinary tract, there's an infection. So just again, just kind of a nice to know slide. Bacteria can be categorized as a gram-positive or a gram-negative bacteria, and there's certain other, also there's anaerobes too. We're just talking about the positive and negative right now. Gram-negative right here does not retain the crystal violet dye when the gram staining process is done, but the gram-positive bacteria does retain the violet dye. So here we have gram-positive bacteria, and here we have gram-negative bacteria. And a couple differences is the gram-positive have this peptoglycan wall right here, which is what retains the dye. So it looks like it's violet. It retains the violet dye. If you take a look at gram-negative bacteria, it doesn't retain the dye because the peptoglycan wall is pretty deep in here, so it can't penetrate it. And there's an outer membrane. Look at this outer membrane on the outside of gram-negative bacteria, whereas it's not on the outside of a gram-positive bacteria. And hence, this outer membrane is the reason that gram-negative bacteria are a little harder to treat and require a stronger or antibiotic. It's a more virulent type of a bacteria. These are in fungus, so we have infections with bacteria, we have infections with fungus, we have infections with viruses. Okay, those are the three main areas. So we just talked a little bit about bacteria. Now this is fungus. An infection with a fungus is called mycosis. So some fungus, and again, this is not something that I want you to memorize the whole thing, but it is important to know that Candida is a fungus, and this is basically yeast. Source, skin, GI tract, vagina. Here's a picture of it. You can see oropharyngeal infections, which are thrush, skin infections, nail infections, vaginitis. So this is a fungus that overgrows when somebody has somebody's immunosuppressed. And often we see it in patients who are on multiple antibiotics, and it immunosuppresses their good bacteria, kills their good bacteria. So then something that's opportunistic can flourish like yeast. Pneumocystis, somebody who has a pneumocystis pneumonia, it's a fungus that enters the body and kind of just lands in the lungs. So often a fungus is transmitted by inhaling, and so they do cause a lot of pneumonias. The second, probably most common reason, are wounds. A fungus can enter the body through a wound or inhalation. And keep in mind, any opportunistic infection with a fungus, somebody who has a pneumocystis pneumonia, they tend to be immunosuppressed. Histoplasmosis, blastomyces, these and cryptococcus, these are basically in the soil. So these are just fungus that are in the soil that people breathe. And again, it shouldn't cause a fungal infection in their lungs, but if they're immunosuppressed, it may. Also, there are birds carry funguses. So you can see here, bird, pigeon, different types of birds can carry these funguses, and people who have birds in their house often present with a fungal pneumonia, and it's because they are just being exposed to it so much. Yeah, so again, skin funguses are often transferred through the skin and through inhalation. So this kind of some important stuff to know about fungus. The next is a parasite, an infectious parasite, or protozoans. It could range from just a one-cell protozoa, or it can range from this one-cell protozoa to a worm, to like a large worm. And a parasitic or a parasitic worm is referred to as a helminth, H-E-L-M-I-N-T-H, a helminth. It can be round worms, tapeworms, flukes, hookworms, pinworms, any of those types of worms. Flukes are like flat worms that can invade different areas of the body. Examples of a single cell parasite would be like a trichomonas, which can cause a sexually transmitted infection, or giardia, which can cause some diarrhea, food poisoning, kind of like drinking water with giardia, and then you have a gastrointestinal parasite. Again, you don't need to memorize these, but a lot of these parasites and these worms are in the soil, meats, infected pork, beef, larvae, and infected fish. That's why we cook our fish, we cook our meat, and in the water. So food and water, contaminated water. Entry route, mouth, 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 skin, mouth, skin, mouth, 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 skin, mouth, 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 mouth. A lot of these are coming through the mouth, through food and water. Malaria is a life-threatening disease caused by a parasite that are transmitted to people through bites of an infected female Anopheles mosquito. So a mosquito can transmit a parasite by biting somebody. It's preventable and curable, both. In 2020, nearly half the world's population was at risk for malaria. Half of the world's population. So it's not, it happens in our country, it happens in a developed country like the United States, but not nearly as much as it happens in the world's population. Most cases and deaths occur in sub-Saharan Africa. However, the World Health Organization regions of Southeast Asia, Eastern Mediterranean, Western Pacific, and even the Americas also report significant number of cases and deaths. There were an estimated 241 million cases of malaria in 2020, and the estimated number of malaria deaths stood at 627,000. The WHO African region carries a disproportionately high share of the global malaria burden. African region. In 2020, this region was home to 95 and 96% of malaria cases and deaths, respectively. That's where the majority of them are. Children under 5 years of age are the most vulnerable group affected by malaria. In 2020, they accounted for about 80% of all malaria deaths in the WHO African region. So just a little bit of information as far as we do have some malaria in this country, but it is definitely restrained with pesticides and different interventions. The last one I'll talk about are viruses and the viral invasions. This is kind of just like that one slide that I showed you, the bacterial invasions and where viruses occur when they enter the body. And these are viruses that tend to migrate and settle in the brain area, a common cold in the nasal area, rhinovirus, parainfluenza, RSV. Same here, viral pneumonias, influenza A and B, parainfluenza, RSV, adenovirus, SARS coronavirus. So eye infections, herpes, adenovirus, cytomegalovirus, these tend to be the common viruses that occur here. These tend to be the common viruses that occur here. GI viruses, adenovirus, rotavirus, norovirus, we hear about these all the time. Herpes coronavirus, they can affect the GI tract. Herpes, papillomavirus, and HIV are STIs, pancreatitis, Coxsackie B. So again, varicella, herpes, smallpox, molluscum, these are viruses that tend to cause problems here in the skin. So just kind of helpful when you become a little bit more knowledgeable on infectious disease and what are the most common bacteria and viruses that we see in certain areas. Influenza, as far as influenza, you don't need to know all this either. There are 4 types of influenza. Influenza A infects a wide range of animals, including birds. Influenza B really only affects humans. Influenza C affects humans and pigs, but it's rare. Influenza C is much, much more rare than A and B. These are the 2 common ones. And in fact, influenza D infects cattle. This is not something that we are overly concerned about either. So we're concerned about influenza A and influenza B. Some subtypes, you don't need to know this, but A subtypes, we have the avian, which can infect humans, the swine, H1N1, most common in humans. Subtypes can be classified as high path or low path based on the ability of the specific virus strain to kill chickens in the lab setting. So again, you don't need to know this. These are just subtypes of how the influenza viruses are categorized. Influenza virus types A and B, again, seasonal, avian swine influenza, type B, seasonal influenza. When somebody gets an influenza vaccine, it's a combination of type A and type B antigens. That's what is in the influenza vaccine. That's important to know. Type A can cause significant disease. Type B generally causes a mild disease, but may also cause severe disease. It is a little less mild than A, but again, depending on the host. Infects humans and other species, so humans and birds. Type B generally is limited to infecting humans. And A can cause epidemics and pandemics worldwide. And type B is milder, so it generally causes a milder epidemic. Sometimes somebody has both, but the influenza vaccine covers both. Next, HIV and AIDS. HIV, human immunodeficiency virus. HIV is a virus. A virus spread through certain body fluids that attack the body's immune system, specifically the CD4 cells, which are a form of T cells. So you need to know that. Over time, the virus destroys so many of these cells that the body can't fight off infection or disease anymore. So HIV destroys CD4 cells, and so immune system goes down. Opportunistic infections or cancers take advantage of a very weak immune system and signal that that person has AIDS, and they just start getting lung infections, brain infections, skin infections. HIV is transmitted through blood and body fluids. Now, AIDS is acquired immunodeficiency syndrome, deadly sexually transmitted disease caused by the HIV, the human immunodeficiency virus. AIDS is caused by HIV. 2/3 of all new diagnoses in the US represent gay and bisexual men. HIV and AIDS, what is the difference? Just kind of a little summary of what I talked about. HIV is the virus that can cause the HIV infection. It damages the immune system by killing CD4 cells. CD4 cells are part of the immune system. HIV attacks and kills CD4 cells. Loss of CD4 cells makes it hard for the body to fight off infection. And these are T cells. CD4 cells, why is this doing this? Are T cells. Okay, and then AIDS. AIDS is the last stage of an HIV infection. As HIV infection advances to AIDS, the amount of HIV in the body increases, viral load increases, and the number of CD4 cells decrease. So these are CD4 cells with a little bit of virus. As it progresses and progresses and progresses, now we have high viral load, low CD4. That's HIV. HIV medicines can stop HIV infection from advancing to AIDS. Very sophisticated now, very well treated. Without HIV medications, HIV advances to AIDS in about 10 years. HIV and AIDS is transmitted through unprotected sex, drug addicts, blood transfusion, pregnancy, non-sterile instruments. It is not transmitted through touching, through food, kissing, insect bites, and in the pool. So it is helpful as a provider that you do know this and that you can, clarify any concerns or maybe misinformation out there. So some other helpful teaching points for patients to know the HIV status of your partner and yourself, avoiding vaginal, anal sex, or use condoms, practicing monogamy, avoiding IV drug use, avoiding being intoxicated with drugs or alcohol because that does promote more of an inappropriate behavior. This is just a slide for the prevalence of HIV. Black male-to-male sexual contact is the highest. Hispanic, Latino, male-to-male sexual contact, next. White male-to-male sexual contact, next. Black women, heterosexual contact, next. Men, women, men, Black men, heterosexual contact, and then down to white women, heterosexual, Hispanic, Latino women, heterosexual. So this is the most prevalent group right here. So HIV takes 3 forms, okay? Immunodeficiency, autoimmunity, neurologic dysfunction. So immunodeficiency, we understand what that means. Somebody has HIV virus, opportunistic infections start to take advantage, and infections in the brain. They start getting like a gyrovecchia, fungal pneumonia, fungus in the brain, GI tract, a lot of GI issues because we have a lot of bacteria in the issues in the gut. Also could be skin, but these are 3 main areas that opportunistic infections occur. Actually, for women, often just reoccurring yeast infections can be the beginning of the symptoms. Autoimmunity, so now they get pneumonitis with a fungal pneumonia, they get arthritis, and have various disease processes that go on. And then the last form, or kind of like the last stage, we start seeing neurological dysfunction. They start getting brain infections in the brain that causes them to have AIDS, dementia. So just some other kind of main symptoms of AIDS: the brain, eyes, lungs. They get tumors on their skin because they don't have an immune system. And then GI, they got a lot of diarrhea, esophagitis, tumors in their gastrointestinal tract. 3 stages of progression. Number 1, acute HIV infection. After initial infection can feel like the flu, or maybe nothing. Maybe they have no symptoms at all. Next is the latency, clinical latency period. So acute period, latency period, may last 10 years and generally have no symptoms at all. And the 3rd stage of progression is AIDS. Acquired immunodeficiency syndrome occurs when immune system has been so badly damaged that it can no longer fight off serious infections and diseases. AIDS is characterized by this: a CD4 count less than 200, that's important to know, and or the presence of an opportunistic infection. So now the CD4 count is so low that these infections are just starting to take over. And also malignancies would be in that 3rd stage as well. Because many people do not have any symptoms of stage 1 and 2, HIV is often transmitted from people who do not know they are even infected. Condoms are the best way to protect spreading the disease. As far as treatment, diagnostic tests, blood tests can detect the presence of an antibody or an antigen in a sample of blood. A PCR is the test for viral load. Viral load high, CD4 count is low. That's what's happening with somebody with an HIV infection. And when the CD4 count gets below 200, that's generally the definition of AIDS. Treatment, there is no cure, but there's a combination therapy that works very, very well called highly active antiretroviral therapy, referred to as HAART. US, most HIV does not progress to AIDS because these medications work so well. With proper medical care, it can be controlled, must be taken early and every day. So these people have to take these medications every single day at the same time. They have to be very compliant for these medications to work, and certainly prevention of transmission from an infected person. All right, well, thank you.